When the last visitor leaves and those hospital doors lock at 9 p.m., the building transforms. The chaos of daytime visiting becomes silence. The nurses who were splitting attention between you and your family now have you fully. But that's also when things happen in hospitals that would horrify families if they knew what was really going on while they're asleep at home. When visiting hours end, hospitals operate under completely different protocols, different staffing levels, and a different priority system that affects your care in ways you won't realize until something goes wrong at 2 a.m. and you're alone with nobody to advocate for you. The first thing that happens after visiting hours end is that your room becomes property of the night shift, and you're no longer a person with family. You're now a patient without witnesses. Doctors make decisions, nurses perform procedures, medications are administered, and nobody from your family is there to see it, question it, or catch mistakes. This changes everything about how you're treated. Families catch errors constantly. A family member notices the nurse is about to give the wrong medication. A daughter recognizes her father's pain has dramatically worsened and calls immediately. A son notices his mother's breathing has changed dangerously. Families are vigilant because it's their loved one, and they know the patient better than any staff member ever will. The moment they leave, that critical oversight vanishes. You become purely a medical case, stripped of the family context that makes you a whole person. The second thing that happens after visiting hours end is that your pain might not get treated as aggressively. Nurses are managing more patients at night. A patient with a visitor has family advocating and monitoring pain levels constantly. When that visitor leaves, you're alone managing pain without someone saying, "My mother is in tremendous pain. We need something stronger." You might suffer unnecessarily because you don't want to be a bother, or because you're embarrassed to call the nurse repeatedly, or because you assume the pain will pass. Studies show patients report more pain at night and receive fewer pain medications. Not because nurses are being cruel, but because they're stretched thin. They don't have visual confirmation of your suffering from family members, and you're not advocating for yourself as effectively as your family would. You suffer quietly while your family is at home thinking you're comfortable because the hospital told them you were stable when they left. The third thing that happens after visiting hours end is that your calls for help might go unanswered for much longer than during the day. You press your call button at 10 p.m. and wait, and wait. Your nurse is in another patient's room dealing with an emergency. Your call light blinks unanswered for 15 minutes. Your family isn't there to physically go get a nurse. You're completely dependent on the call system working, the nurse noticing, and the nurse being available. And that's a fragile chain. Here's the reality. At night, one nurse might be managing 8 or more patients. During the day with visitors, there's ambient staff activity, additional nurses, nursing assistants, housekeeping, transport staff visible and available. At night, that staffing drops significantly. Your call button might not even be heard over the noise of another patient's monitor, alarming or another nurse's urgent needs. The fourth thing that happens after visiting hours end is that you're more likely to fall, and nobody's there to help you. You wake up at 2 a.m. needing the bathroom. You're groggy, maybe still on pain medication, maybe not thinking clearly. You try to walk without calling for a nurse. You're dizzy. You fall. You hit your head. You break a hip. You're lying on the floor and nobody finds you for minutes or longer. When your family was here, you had help getting to the bathroom. Now, you're on your own. Nocturnal falls are common in hospitalized patients, especially elderly patients. The bathroom is the highest risk location. Patients fall when they're alone, at night, trying to be independent or not wanting to bother nurses. Falls in hospitals cause serious injuries, head trauma, fractures, complications that weren't part of the original illness. Falls often happen after visiting hours end because families aren't there to provide physical assistance or immediate help if something goes wrong. The fifth thing that happens after visiting hours end is that your condition can deteriorate significantly before anyone notices. You develop chest pain at midnight. You're not sure if it's serious. You don't want to bother the nurse. You lie there monitoring it yourself. By 2 a.m., it's worse, but you still don't call. By 4 a.m., you're having a heart attack. The night nurse finally realizes something's wrong when you're in crisis. If your family had been there, you would have called immediately. Without them, you delayed seeking help. Patients are terrible at recognizing medical emergencies in themselves. They minimize symptoms. They hope things improve. They don't want to be high-maintenance patients. This self-minimization is dangerous at night when there's no family to say, "Something's wrong, call the nurse now." Serious conditions develop while patients are alone, uncertain, and reluctant to call for help. The sixth thing that happens after visiting hours end is that you might be given medications or treatments without full informed consent because there's no family member there to ask questions or verify you understand. A doctor comes in at 11 p.m., tells you they're starting a new medication, and leaves. You're groggy, confused, maybe not even fully awake. You nod. Later you realize you didn't understand what the medication was for, what the side effects might be, whether you had alternatives. Informed consent is supposed to be a conversation, not just signing a paper. When family is present, they ask questions. What are the side effects? Are there alternatives? Why this medication specifically? Without family, patients often don't ask, and staff sometimes don't ensure understanding because they're rushed. You're receiving treatment you don't fully understand and can't discuss with family until the next day. If you're learning what really happens when hospitals close their doors to visitors, hit subscribe. We're exposing the dangerous gaps that happen after families leave. The seventh thing that happens after visiting hours end is that your room becomes less safe in ways nobody warns you about. At night, fewer staff are walking the halls. Security presence is reduced. The likelihood of staff noticing if someone enters your room without authorization is lower. The likelihood of someone taking something that doesn't belong to them, medications, valuables, property, increases. Your room is less observed, less protected, less supervised. Thefts happen in hospitals, especially at night. Staff members take medications. Visitors steal from other patients. Intoxicated or mentally ill patients wander into rooms. Your room is a private space during visiting hours because family is there monitoring, but it becomes semi-public and less secure once they leave. What happens after visiting hours end is that hospitals operate on a completely different safety and care model than what families see during the day. Your pain might not get treated. Your calls for help might not be answered quickly. You might fall without help nearby. Your condition might deteriorate while you're alone and afraid. You might be given treatment without full understanding. Your room becomes less secure and less observed. And if something serious happens, there's no family there to advocate for you or ensure the medical team takes your concerns seriously. Understanding these gaps means asking if family can stay overnight, asking about specific monitoring plans for nighttime hours, asking what symptoms should trigger immediate notification, and asking about staffing ratios overnight. Because the hospital won't warn you about what happens when visiting hours end, but you should know that everything changes, and not always for the better.